Welcome back. My name is Alex and I am a patient support guide at AFREZZA Assist. In this video, we're going to talk about AFREZZA dosing. With AFREZZA, insulin is delivered through the large surface area of the lungs, which allows for ultra-rapid absorption. Whether you've had diabetes for 1 week or 30 years, we're confident you'll learn something valuable about how inhaled insulin may work in a new and different way than the injected insulin you may be used to. Together, we'll review our downloadable dosing worksheet, how to dose with AFREZZA cartridges, a dose conversion chart, and the unique speed of inhaled insulin. If you haven't yet watched the How to Use AFREZZA video, I recommend watching that first for an introduction to AFREZZA and to understand the proper inhalation technique. To get started, you'll want to review your notes from your last appointment to see what you and your healthcare provider discussed as an appropriate starting dose. If you can't find any instructions from your healthcare provider, make sure to ask before starting AFREZZA. By visiting the resources and support section of our website, you can download a dosing worksheet and fill it out with your healthcare team. Step 1 will note your prescribed AFREZZA dose you'll take at the beginning of your meal. Step 2 will note when to check your blood sugar to see how AFREZZA is working for you. The American Diabetes Association suggests checking your blood sugar 1 to 2 hours after the beginning of your meal. Step 3 will help you understand what to do when your blood sugar is high. Because AFREZZA is an ultra-rapid acting inhaled insulin, it leaves the body within 1.5 to 3 hours depending on the dose. This gives you the option to take additional follow-up doses 1 and 2 hours after meals if needed. Step 4 will let you know when you should check in with your healthcare team to adjust your dose. We recommend scheduling an appointment or telephone call with your healthcare team within the first 2 weeks of beginning AFREZZA, so you can work together to adjust your dose up or down based on your blood sugar levels and how AFREZZA works for you. For some of you watching this video, it may be your first time taking mealtime insulin, and you may have been prescribed a certain color cartridge for each meal. AFREZZA insulin is a dry powder supplied in 3 color-coded cartridges, which offer different sized doses. These cartridges are also clearly marked with the number of units at the bottom. Blue cartridges contain 4 AFREZZA units. Green cartridges contain 8 AFREZZA units. Yellow cartridges contain 12 AFREZZA units. If your prescribed dose is greater than 12 units, multiple cartridges and inhalations may be needed. For example, taking both an 8-unit and a 12-unit cartridge provides a total dose of 20 units of AFREZZA. For others of you watching this video, you may have lived with diabetes for many years, and you may want more advanced information about how AFREZZA works compared to the injected units you may be used to. Because AFREZZA is inhaled and is in powdered form, 1 unit of AFREZZA may work differently than 1 unit of injectable liquid insulin. Based on clinical trials, it may take approximately 1.5 times the amount of AFREZZA to achieve the same blood sugar control as injected insulin. AFREZZA will also be different than injectable insulin because it is delivered through the large surface area of the lungs, allowing for ultra-rapid absorption. Because of this, AFREZZA lowers blood sugars rapidly, similar to the insulin response of a person without diabetes. According to the American Diabetes Association, there are different types of insulin and they vary in how quickly they work, when they peak, and how long they last. Time to first effect is the length of time before insulin reaches the bloodstream and begins lowering blood sugar. AFREZZA gets into the bloodstream in less than 1 minute and starts controlling blood sugar in about 12 minutes. Because of this ultra-rapid onset, AFREZZA should be inhaled at the beginning of a meal. Time to peak effect is the time during which insulin is at maximum strength in terms of its ability to lower blood sugar. AFREZZA peaks in 35 to 45 minutes. Duration is how long insulin continues to lower blood sugar. With AFREZZA, the insulin leaves the body within 1.5 to 3 hours. Because of this, using AFREZZA gives you the option to take additional doses at 1 and 2 hours after meals if needed. Remember, just like any new medication, it may take some time to figure out how your body responds to AFREZZA. Be patient with the initial learning curve and give yourself a little time to figure it out. After you've had a chance to try your starting dose, follow up with your healthcare team so you can work together to adjust your dose up or down based on your blood sugar levels and how AFREZZA works for you. Please remember to always ask your healthcare provider if you have any specific medical questions. If you would like to schedule a training with us at AFREZZA Assist, we are here to help you get the support and answers you need. Just give us a call.
AFREZZA is a rapid-acting inhaled insulin used to control high blood sugar in adults with diabetes mellitus. AFREZZA can cause serious side effects including sudden lung problems, low potassium, and heart failure. AFREZZA is not for patients with chronic lung disease such as asthma or COPD. Tell your doctor if you smoke, recently stopped smoking, have ever had kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace basal insulin with AFREZZA. AFREZZA is not for use to treat diabetic ketoacidosis. Do not take AFREZZA if you are allergic to insulin. Talk to your doctor before changing your AFREZZA dose. Blood sugar may need to be checked more frequently. Please see accompanying full prescribing information for AFREZZA. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.